I'm aware I'm an awareness raiser in the community. So at the end, if you do have any questions, I can answer. I welcome the questions. But if I feel that I can't give you any medical background, then I will take the questions away and email Pippa with the answers. Now, I would like to share my presentation. I hope everybody can see that.
Yes, please.
Yes, please.
Okay, right. I'm going to talk a little bit about tuberculosis. I've got a few languages just to make sure that people can understand what I am going to be talking about tonight. TB is a serious but curable infection caused by airborne bacteria. What we've got to remember, there's lots of different bacteria in the air. And what we do is sometimes we breathe in this bacteria. Now, once we've breathed in TB bacteria, it can affect any part of our body, mainly lungs, because we actually breathe it in through the air, which is around us, and we breathe it in through our mouth, nose, and it goes through our lungs, and it can go into any part of our body. And anybody can be affected by the TB virus and infection. Now, just to let people know, there are two types of TB. There is the latent TB, which is a dormant TB bacteria that we can breathe and it stays in our body. It has no symptoms. And the person doesn't feel ill with the latent TB. We call it sleeping TB because it doesn't do anything. It goes into our body and it goes to sleep. Usually when we identify latent TB, which further on I will tell you how we identify it, there's a treatment of antibiotics lasting up to either 3 months to 6 months to kill that bacteria that is in our body. Now, the active TB is a TB that goes into our body and it multiplies. The bacteria slowly, over a period of time, starts to reproduce and damage our tissues. It goes into the lungs, and like I said, it can go to any part of our body. It can affect your eyes, your spine, your brain, any part, your stomach, bowel, any part of your body can be affected. People that have TB have symptoms, and later on I will talk about some of the symptoms as well. It's an infectious risk once the TB is in the lungs. So if you've got TB and you're diagnosed that it is in your lungs, which means you will be breathing it out and other people can get TB off you. Now, the treatment for TB, infectious TB, is anything up to 6 months and you're on 4 antibiotics, which I will talk about as we go through the slides. Now, you are more likely to get TB if you know somebody who has got infectious TB, meaning they are very ill and they've got the symptoms. You do not get TB from people that have got sleeping TB because it's not doing anything and it's not infectious. TB is more prevalent in cities, in countries like Salvation, African, some Eastern European countries. TB is in areas where people are poor, overcrowding. Prisons have known this, TB in prisons, and also people that live in very poor conditions, like I've mentioned. We tend to have TB in major cities like London, Birmingham, and Manchester. And if somebody, like I said, has got TB, then you might have breathed in the bacteria. Okay. Now, some communities that are more at risk of TB than other people that are healthy are people from the BAME community, like I've already said, African, South Asian communities, people that are living with HIV, people that are homeless, and people that are dependent on drugs, alcohol, and also people that have low immunity. How is TB transmitted? People get TB if they breathe in large amounts of bacteria. So you need to be around somebody for over 8 hours to actually be affected with TB. So like I said earlier on, if you're living in, overcrowding space, if you're in prisons where there's a lot of people, if you're living in areas, where people are poor, you're more prone to get TB. Now, bacteria spreads through the air after somebody has got the infections. And the coughing, because what we've got to remember when we are talking, when we are amongst our friends, when we are breathing, we're letting out little droplets into the air, little droplets, and then they stay in the air and other people breathe them in. You do not get TB by spitting, sharing services, or sharing cups and cutlery. You do not get TB like that. You get TB when you're amongst people and they are breathing as we all breathe. Okay, how does TB work? So 60% of the healthy adults completely kill off the bacteria. So if I was amongst a big group of people and my immunity was healthy and I breathed in the bacteria, my body would automatically kill it off. There are 30% of people whose immunity is not good, because remember, we've all had, people have had COVID, people live with other infections, other diseases, other health issues like diabetes, heart problems, blood pressure, and what happens then is you breathe in TB bacteria and it goes and sleeps in your body. And then you will find 10% of the people, because their immunity is not well, they become ill straight away. So they start to get symptoms that are TB, but it takes a long time for them to know it's TB. And the reason is, when we get bacteria of TB into our body, it slowly multiplies. And over a few weeks to months, you start to get a cough, which carries on for about 3 weeks. And you go to the GP, the doctor, and they give you antibiotics. And you still don't feel well. You still have cough. You have sweats at night. You sweat so much that your bedding is wet and you have to get up and change. You have a fever and it doesn't get better with ordinary antibiotics. You feel tired, night sweats, you start to lose weight, your appetite shrinks. So these are all the symptoms of TB. Some people would say, hold on, I had COVID and I had these symptoms. I'm going through menopause and I have some of these symptoms. Yes, there are lots of illnesses that have the same symptoms. But however, what you have to realize is if you've had COVID, after a few months, you start to feel a little bit better. If you've had other illness like a flu, a bad cold, you start to feel better with normal antibiotics. But with TB, you don't feel better. And that's when you realize that you might have TB. And that's when you say to the GP, I've had antibiotics and I'm still not getting any better. Can you send me for a TB test? Because the reason is the TB has to be treated with special antibiotics that are very, very strong. So ordinary antibiotics do not cure TB. Okay. So what happens if you've got TB? Okay, you think you've got TB, or you might have got a family member that's got TB, or you might have a friend, or you might have a work colleague who's got TB. You need to go to your doctor, and what the doctor will do, they will refer you to the hospital, or you can go to an A&E if you really, really feel ill. And the other thing is, what I must say at this point, that anything you discuss with your GP or you go to A&E regarding TB does not get discussed anywhere else. You know, if you tell the doctor you don't want it going on your records, it does, you know, they don't put it on your records. It's all anonymous and you get treated at the hospital. Now, the other thing I must really let you know, if you are an asylum seeker or you don't have no recourse to public fund, you still waiting for your asylum to come through, you know, you're a destitute, the treatment is free. Despite your status, because in UK, what we're trying to do is catch TB earlier and treat you. So for us, it doesn't matter what your status is. Yes, you know, you can give us a name, go to the main hospital, give us a name. You don't have to give us your full proper name. Long as we know where you live or where we can contact you, you will get treatment free. And the antibiotics, like I said, could be anything from 3 months to 9 months. And, you know, everything is confidential. So nothing to worry about regarding your immigration status. How to prevent TB. This is the part I really like to tell people, because people don't realize that TB is so much preventable. First of all, when we were children, or when we come to UK and in lots of the countries where TB is high, everybody gets given a vaccination called BCG. And it's a very unique vaccination, I must say, because it leaves a little mark on your shoulder. So if you've got a little mark on your shoulder, that is your BCG vaccination. And now it only lasts about 15 years. After 15 years, the effect of the vaccination goes low, which means that you can be prone to get TB. There isn't another vaccination that you get given. Only if you've come from countries where you might have not had vaccination, where your children have not had vaccination, then at the MRI hospital or your local nurse can give you a BCG immunization. But as adults, you don't get a BCG vaccination. And once you're over 35, then the vaccination doesn't have effect on your body at all. It just it kind of wears off over, you know, over the year, 35 years of age. Now, Department of Health recommend that if you've got children that are under 16 and they've not had a BCG vaccination, you can go to your GP and ask that, you know, you want your child to be given vaccination because they've not been given vaccination, and they will refer you to the hospital to have the vaccination. All babies that are born in UK, part of the Red Book, we do give BCG vaccination. It's a common practice, especially for people that, you know, have come from countries where TB is high. Now, how does TB infection spread? If you have got untreated infection, you could affect up to 10 to 15 people per year. So that means basically, if I had TB and I was coming into your group face to face and seeing you every week, I could be affecting about 15 people in that group in a year. Yeah. And once you start the treatment, after 2 weeks of that treatment, it's not infectious. You can't affect anybody. So that's why it's really, really important. Like I said, If you've got any signs and symptoms like I have described earlier on, do please go to your GP just to be screened to see you've not got infectious TB. And the best way is, soon as we can diagnose TB, the quicker we can stop it spreading. What we tend to do, which is, people do get a bit scared, but what I'd like to let you know, how does it work? Okay, so you've got TB. What will happen is we will treat you, and then we do case finding, which means we will ask your immediate family members to all be screened. Screening means a blood test or a skin test. It's nothing other than them two, or maybe an X-ray, depending on your age. Usually over 60s, we do an X-ray. Anybody under 60, we tend to do a blood test or a skin test. So what happens, like I said, your circle. So it's you. First of all, we treat. Then we ask to see your family members, even the children. We test them to see if they've breathed in any bacteria. And then we go to your outer circle, which means your colleagues at work, or if you're studying, your colleagues at college. We send them letters. We ask you who you've been in contact with. And then letters go out and we invite them for TB screening. And then we work to a bigger circle. So if you go to any places like churches, mosques, any religious places, gatherings where you might have gathered, where you socialize, we call them people in just to be tested, just to make sure that you've not, passed it on to anybody. Okay, so how do we stop spreading TB bacteria? NHS guidelines are that you should open your windows at least an hour a day and let fresh air dilute any bacteria in the house. That means it could be any kind of bacteria, not necessarily TB. So if we want to get rid of any kind of bacteria in our house, we must at least open the windows in all our rooms just to get some fresh air in, to dilute the air, and we get fresh air into the house, or in a flat, wherever you are living. Even in workplaces, even in churches, even in mosques, wherever, we should open the windows just to get that fresh air in and get rid of any bad bacteria that is lingering around with lots of people coming together. Natural light helps to kill the bacteria. So it's really important that we get natural light. And the way we get natural light is by making sure our curtains are open and we're getting much daylight as possible. Also, going out is really important for us to go out and get some fresh air and get some daylight, especially now that the clocks have changed and we only get so many hours a day of light. So do make the most of it by going out during the daytime and breathing in the fresh air and getting some daylight. Also, when you are sneezing, coughing, please cover your mouth and nose. Use a tissue and throw it away, and make sure you wash your hands. Immunity, very important, not just for TB, but for any health issue, any prevention around health. What we need to do is eat healthy, 5 a day, our fruits, vegetables, protein, and make sure we do enough exercise. Walking is free. We can go out and walk. We don't need any money, for gyms, anything natural, just anything that you can do, exercise. You can exercise in the house. You can put on a YouTube video and just exercise. It's good to keep your body moving and, feeling good in yourself. Mobility is really good by moving yourself, doing a bit of exercise, going out for a walk. Helps to keep your immunity intact and good. Again, back onto diagnosis, treatment. So, skin test. What we do at the hospital, we put a little bit of liquid called tuberculin into your skin and we leave it there for 48 hours. And then we call you back after 2 days. And then we have a look at what the results are, and it'll be on your skin. It shows if there's a little lump, we measure the lump, and that will indicate if you've ever been exposed to TB. Or we do a blood test, like I said, and the blood test is a very complex blood test. We take 4 bottles of blood, but only a millimeter in each bottle, which is 4 mils of blood, which is very little. It's like a teaspoonful of blood in 4 little valves, and we send it to be tested to see if you've got any TB. That checks to see if you've got any latent sleeping TB or if you've got active TB. The other thing is we do a chest x-ray. Chest x-ray shows us if you've got any bacteria on your chest. It shows us little holes in your lungs, which indicate that you've got cavities. And that's where we can tell if you've got cavities, that means you've actually got TB in your chest, and then we can treat you. Sometimes we will ask, if you tell us that you're bringing up phlegm, when you're coughing, you're bringing up phlegm, what we do, we'll give you little bottles and we tell you to take them away. And we ask you over 3 days, cough and collect that in a little bottle. And then we send that to be tested and see what bacteria we get. It's a cultural test to find out what culture. So we've got lots of different types of TB, and we want to see what form of TB you've got. And then depending on the TB, we will treat you. Like I said, TB is free. TB treatment is free for anybody that is living in UK, despite your status. It can last for 6 months. But sometimes we have to treat you for 9 months. It depends. And sometimes if the TB is very, very infectious, then you might have to stay in a hospital for a few weeks till we can, if it does make you very ill. And if you are very, very ill and you can't eat because if it's in your lungs, you might have glandular TB. So you might have glands which are really swollen, and you're very, very ill, and then we will keep you in hospital for a few weeks to make sure we can give you the antibiotics, we can drip feed you to bring your immune, build you up, and then you will be sent home, hopefully, feeling more better than you came into the hospital. Like I said, it's really, really important. In the olden days, 40, 50 years ago, there were no treatment for TB. People were left to die. But now we're fortunate, we're fortunate that through time we have found some treatment and you can be cured. The earlier we can find TB, the sooner we can start your treatment, and you can be 100% normal, better, back to work, back to your full immunity. Now, sometimes what we find is people become drug resistant, and that could take a longer treatment to kill the bacteria. So, we can treat you, like I said, over 3 months, 6 months, 9 months, even longer than that, but there is treatment. First 2 months of treatment, there's 4 antibiotics that you get put on, which you have to take every day for 4 months. And then once we start to kill the bacteria, then you get put onto 2 antibiotics for the rest of your treatment. What usually happens is once you put on treatment, we call you into the hospital or we come to your house and we will give you more medication. We'll check on you, how you are. And also every month we will do a blood test to make sure that your kidneys, your liver, everything is functioning. Alongside these antibiotics, we will put on some vitamin tablets as well to build your immunity, to make you feel stronger as well. Now, I'm just going to go back and say that once you're on this treatment, even if it's 3 months for the sleeping TB, if it's for 6 months or 9 months, you must have that treatment to complete it, to get rid of the bacteria. Soon as you stop your treatment, in between, the TB will start to grow. Yeah. What you've got to imagine is it's a little bacteria that really grows and grows and grows and makes you very, very ill. And we can't get rid of it till you have your full course of treatment. So even if you've had it for a week, the treatment, so you start your tablets, you have it for a week and you think, I'm not feeling well, I don't want these tablets. You must not stop them. You must go back to the hospital and tell them, or ring the nurse that is dedicated to help you, that I'm not feeling good with this treatment. Can you help me? And they will change your antibiotics, but you must complete the treatment to stop that bacterium multiplying. And if you have any side effects, the treatment is longer. They will put you on small doses, but they want to get rid of that TB in your body. So what you will do, what will happen is you will get a nurse who will keep an eye on you, who will be your designated nurse. They will treat you either in the hospital or you will get home visits from these nurses to make sure they can support you with any concerns you have. So I hope, I'm going to stop sharing here. I hope that I've given you enough information and encouraged you that you will actually take up the treatment. And I must say, another intervention that the government is doing at the moment, which has been going on for the last few years, if you have come to this country from an area like South Asian, African, Eastern European country, and you come and register with a GP, we will get your intelligence, we will get your information, and we will send you a letter within the first couple of years of you registering. I know I said couple of years, and the reason is we have got a lot of people waiting to be screened. So we will send you a letter and we will say to you that we are calling you in just to check if you've got TB. And the reason is that the government want us to call people that have travelled from other countries to come to UK that they don't have any sleeping TB in the body. Because if you've got sleeping TB, we want to treat you just in case later on in life you end up with cancer, HIV, other illnesses, and then the TB, which is sleeping, will wake up. And once it wakes up, it will make you very, very ill, and we can't treat you for cancer or any other illnesses till we get rid of that TB in your system. So that's why it's really, really important to be screened, checked, and treated. At this point, I will ask, are there any questions that anybody wants to ask me? Or if they're not any clear on what I've been talking about?
Nsamanwa nkɔmɔ a yɛne yɛnua Shaz Sheikh edi na abɛwie na ɔsrɛ bisa sɛ yɛmu bi wɔ ase bisa bi a mpamokyɛw obetumi ebisa na yɛnua baa na yi ano ama yɛn. So Shaz just ended the presentation on tuberculosis, and she's asking if anyone has queries. We can actually put them up in the chat, or we can unmute ourselves and then ask Shaz, and then she'd gladly explain to us.
You're welcome, Rachel. I must say, if you do receive a letter from your local hospital saying that we'd like you to come and get screened. If you can't make the appointment, just ring up and make another appointment. It's really good, to just go. It's a free test as well. I know it takes a little bit of time for you to go and visit the local hospital to get to get checked out, but it saves you getting TB in the long run. So just don't miss that opportunity, because they only send you that letter once. And if you miss that opportunity, then, you don't get that letter until you become ill. Yes, you can request a test if you feel that you've been exposed to TB. If you've gone and visited your home country and somebody said, I've got TB, or they're coughing around you, and later on you find out that they've been diagnosed with TB, you can go to your GP and say, look, I went to my home country, or I was amongst friends here in UK and somebody mentioned the word TB, so I really do want to get screened. So the GP will refer you. The GP does not do the screening. They do not do blood tests for TB. You have to go to the hospital that actually does the screening. And in Manchester, if you're from Manchester, in Manchester, North Manchester Hospital does TB screening. We've got Salford, and we've got the MRI. And there are some cases that are taken up at Wythenshawe as well. Yeah, sure. I will be there with lots of information in languages to give out. And anybody can come up to me at your event on the 16th of December and ask any questions. If you don't want me to ask me tonight, do save your questions for that day. And, I will share any information with you, and I'll give you some information. I'll give you little cards that tell you the symptoms that you can keep on you. They're like credit cards that you can keep on you in case you know of anybody that has them symptoms. You can give them that little credit card and say, go and get checked out. You're welcome. I'm glad it's been an informative session and you've learnt.
Any more questions, please?
Mr. Gordy.
Hansen.
Yeah. So, is this something that you can inherit from a family member, especially from your parents?
Sorry, I didn't hear that.
He's asking if it's hereditary, like you can inherit it from your parents.
It's not hereditary, but if you've been around, okay, I'm just going to give you a case scenario there. So when we go back home to our country, yeah, wherever you're from, you have older parents, you have older grandparents, you have older people around you, or people around you generally, they're coughing away, but we don't know what they've got, yeah? So you might have been around your grandparents, your parents, and they're coughing away, you don't know what they've got, and they pass away, and later on you find out they've had TB, but you didn't know that. But you might have breathed in that bacteria, so you don't know who you've been around. Yeah. So it doesn't mean it's hereditary. It's just that you could have breathed in that bacteria from family member, from anybody in the village. If you're, from a village, anybody around your country, anybody here, and it can stay in your body. In the olden days in UK, there were a lot of farmers. Yeah. And people had farms, and they had, they used to milk the cows, and they used to drink it unpasteurized. They didn't pasteurize it. So they used to drink it unpasteurized. So we are finding cases of bone vine, it's called TB. And that's because they drank unpasteurized milk. And we're finding that. So, it's just one of them things that you might have been around your grandparent or somebody who might have had TB, your father, your mother, and you didn't know as a child, and you've come back to UK and we check and we say, oh, you've got latent TB. Can stay in your body for decades without harming you. But like I said, when you get ill, it'll come alive, and that's when it harms you. That makes you very ill. I hope I've answered your question.
She's asking if she's answered your question right. But he's saying it's actually right.
Madam Pacho, let me repeat symptoms in my.
There's Auntie Comfort is asking if you can repeat the symptoms. Can you put the slides up again for the symptoms, please?
Sure, just 1 minute. Bear with me to find the slides with the symptoms. Sorry, just bear with me and I'll see where my slide is with the symptoms.
No worries at all.
There we are. So it's a cough. Over 3 weeks, it carries on and carries on. You've had antibiotics, still doesn't go away. Fever, tiredness, night sweats, weight loss, and no appetite. And at this point, I'd like to let you know that you can have TB in the eye. Sometimes when you have problems with your eyes, and you go to the optician and they send you to the eye hospital, and the eye hospital has a list of things they have to mark off. And one of the things is a TB test, because you could have TB in the eye. It's not contagious, but you can have it in the eye and it's making your eyesight really bad and blurry. So if we find that you've got TB in the eye, when we start treating you, it clears up and your vision comes back properly. Otherwise, you start getting this, like a veil over your eye and you can't see, it's cloudy. So you can have TB in the eye. So don't be surprised if you have an eye problem and they send you to have an eye check for TB. All they're doing is checking that you've not got TB in the eye.
Any further questions? Okay, Shaz.
One might ask, do you have to get all the symptoms together to know that it is TB, or some of them might not be present?
Some of them might not be present. It could be any of these symptoms. It could be that you're always tired, you've lost your appetite, and you're losing weight, but you've got no cough, yeah? You know, you don't have a fever, and the doctor can't get to the bottom of what's going on. Then you can say, look, you know, you've sent me for ABC tests. What about TB? You know, it might be that you've got TB and you don't know. So, yeah, it doesn't have to be in them order. But the cough indicates that you've actually got it in your lungs. If you've got lumps under your throat and they're not going away and you keep getting a sore throat, and you've got little lumps, it's always good to go and get it checked out, because you could have TB under your throat. So if any treatment you're having and you're not getting any better, always ask your GP, can you just rule out TB for me? Because it could be TB causing it. Because sometimes doctors, they forget that TB is still around. And especially with us being from, countries where TB is high, we always need to put it on the radar of the GP to say, you've done ABC tests and you found nothing. What about TB? Have you thought of that? So I'm just trying to empower you to make sure that you get checked. If you're finding that they're not getting to the bottom of why you've got an illness, always ask them, have you thought of TB? And they might do then get you tested to make sure it's not TB that's the underlying cause of your illness.
Thanks, Shaz. AY is asking what medicines or natural remedies we should avoid when we notice these symptoms.
There aren't any remedies I would say you would avoid. The only thing I would say to you, eat healthy and go to your GP, because there's nothing that will help get rid of TB naturally. There's nothing naturally that will help get rid of TB. It's a bacteria that, you know, it just grows and grows. The longer you leave it, the weaker you become. You know, there might be remedies for other things, like if you've got a flu, cough, colds. You know, there are lots of traditional remedies we would use in our culture. But for TB, there isn't a natural remedy. The only way we can avoid getting TB, which is similar to COVID, what you've got to remember, COVID is touching things and bringing it to your face. But TB is in the air. We can't control TB, how we get it. The only thing I always recommend to people is when we have lots of people visiting you, once your relatives, your guests have gone, open the windows and let the air be diluted to get fresh air in. So if there's any bacteria lingering around, despite whatever bacteria, we get rid of it by opening our windows.
Thanks very much, Shaz, for this wonderful presentation. We've all personally, like I always say, we learn something new every day. Personally, I didn't know TB could affect the eyes, but now I'm enlightened. So thanks very much. Wish you well on your advocacy.
Thank you.
We hope to see you again. Thanks very much.
Sorry, was that a question?
Brother Hansen.
There is a question.
Oh, okay. Mpacho Bisa.
What message, you know?
He's asking if it is dangerous to use the same cup with people.
No, like I said, you can't catch TB by using the same cup, glass, or anything. Yeah, people used to think in the olden days that if anybody's drank from one mug, cup, plate, whatever, use any of them. No, you do not get TB like that. TB is in the air. It's around us. We breathe it. We breathe it out. Yes, you can't avoid it. It's not something like COVID that you touch. TB is breathed out when we're talking, when we're breathing. That's how TB is. It's in the air. A prime example is if you put a mirror in front of you and you talk, you will see it steams up. And that steam is coming out from our mouth, from our nose all the time. So we can't really stop passing it on because it's in the air. That's how you catch it. So if you're in a confined room and you're breathing and there's somebody else in that room, it's in the air. So that's why it's important to open the doors and the windows to dilute the air so you don't breathe it in. I hope I've answered that question.
Yeah,
Most definitely.
Explainable. Thanks very much once again, Shaz. Wish you
You're
well.
welcome.
And we hope to see you at the expo.
Yes, we will be there.
Sure.
Thank you.
All the best, and thanks for coming. Have a wonderful evening.
Thank you very much. Everybody have a wonderful evening.
Thank you.
Take care. Bye.
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 Thanks to all others who joined us this evening for this program. I'd like to hand over to the Personal Ministries Department, and then we'll continue with our Bible studies. Thank you.